All right, so this is going to be the eye exam. So I'm going to start with my patient seated in front of me. I'm just going to observe, looking at the eyebrows to make sure that they're filled in and symmetrical on both sides. We look at the eyelashes to make sure that they're curved outwards, that there's no inflammation or anything like that. Also looking at the eyelids to see if there's any redness or swelling. I'm going to then take my thumbs, if that's the right patient, underneath. I'm going to be looking at the conjunctiva and the sclera, making sure that there's no inflammation or abnormal redness and that the sclera is nice and white. And then I'll ask my patient to look up, and I'll be looking at his cornea and the lens to see if there's any cloudiness for glaucoma. And then from there, I'm just going to palpate the lacrimal gland, which is right on the inside of your eyes. Is that all right? And then just let me know if there's any pain or tenderness with that. Okay. All right. Sounds good. And then from there, we're going to go into the fundoscopic exam. All right. So get that. And then I'm going to start by making sure that it's focused by looking about 15 feet away. And then can you turn the lights off, please? I'm going to turn it on. And then for the patient's right eye, I'm going to be using my right hand and my right eye as well. So I'm going to line up about 15 degrees lateral from the nose on the same level as the patient's eye. And I'm just going to come in here, stabilize the patient's head. And I'm going to first look for the red reflex. I'm just going to move in from there. First locate the arteries, look at the optic disc, and lateral to that is the macula. And with that, I'm making sure that the optic disc and the macula have clear defined borders with no crescents. So then patient, if I can have you swing your legs over to the side. So then for the patient's left eye, I'm going to be using my left hand and my left eye. We're going to be doing the same thing. We're going to go 15 degrees lateral from the patient's nose. And we're going to locate the red reflex. Move in until we can see the arteries. And then from there, we're going to locate the optic disc and the macula. Doing the same thing, making sure that there's clear and defined borders and no crescents. Turn that back on, please. All right. And then from there, we're going to move into Perla. So first thing of Perla is just going to observe the patient's pupils. Make sure that they are good and round and the same size, and they are generally like not super dilated or super constricted. So yours look good. And then from here, we're going to do direct light and consensual light, just seeing the pupils constrict. So if I can have you cover your nose like this. All right. So I'm going to shine obliquely across the patient's eye, making sure that the direct side constricts. We do the same thing, observing the opposite eye, making sure that pupil constricts. I'm going to do the same thing on this side. All right, looks good. So then from there, we are going to do the H pattern. So I'm going to ask you to focus on my pen light here, keeping your head still, and just follow with your eyes. All right, awesome. And then one thing I did forget in Perla is a combination. So I'm going to hold this out on the end of your nose, and I'm going to ask you to focus on the pen, and then look past it, and then focus back to it. So I'll hold it right here, look at the pen, and then look past it, and look at the pen again. Awesome. And with the accommodation, I'm looking for his pupils to constrict while he's looking at the pen, and then looking at a farther object for them to dilate. All right, so then from there, we're going to go and do the corneal light reflection test. I'm just going to shine my pen light on the patient's forehead, making sure that the reflection is equal on both eyes. Which I'm going to do right here, which it is, just at the top of the pupil on both sides. Perfect. All right, and then from there, I am going to get behind the patient. If you can scoot up just a little bit. We're going to be doing visual fields. So I'm going to be coming behind you and just point to both hands when you see them. So what can you see right here?
Mm-hmm.
All right. So come up the top, side, and from below. Awesome. And with that, just making sure that You can see both sides, and that is generally at the same side or at the same time. And then we're going to finish up with visual acuity. So with the small pocket sound chart, I will hold it about 14 inches from the patient's face and ask him to read the lowest line of numbers that he can read.
The very bottom one, 372646.
All right. And you got that both right. So that is 20/20 vision, and that will conclude the eye exam.